This is the second portion of the phlebotomy practical exam. In this video, I'll be explaining and demonstrating the butterfly method for venipuncture. So it's very similar to the other two methods. What you'll need for this procedure is you'll need a butterfly syringe, you'll need disposable gloves, alcohol wipe, gauze, you'll need a tourniquet, as well as evacuated tubes, a biohazard sharps container, and an adhesive bandage. So for this procedure, you'll um, you'll want to only use the butterfly method on children or adults that have difficult or small veins, especially in the antecubital area. Um, the typical sites for the butterfly method, they're typically on the forearm, the wrist, on the thumb side, or the back of the hand. So for this procedure, I'll kind of be showing you the back of my hand. And so once you've established all your equipment and make sure you had all of your materials ready to go, you would go ahead and perform hand hygiene, greet the patient, same as the other venipuncture methods. You would see if the patient needed to fast, and you would ask the patient their full name and date of birth to identify them, and then you are ready to assess their veins. So for, like I said, the different sites, you have different spots to apply the tourniquet. So you can apply the tourniquet to make the veins easier to find. So if I were going to be drawing from the forearm, I would apply the tourniquet here. If I were going to be drawing from the wrist, I would apply the tourniquet here. And then if I were applying drawing blood, from the back of the hand, I would apply the tourniquet here, so you can kind of see. So the tourniquet, you apply it the same way. Go up underneath the arm, hold the two ends together, twist, tuck the flap, one of the flaps underneath so that it's secure, and make sure both of the ends are facing upward. So once you have applied your tourniquet, you can then assess the veins, palpate, kind of find a good spot where you think will be the best site. And once you have done that and you've mapped out where the vein is at, you will remove the tourniquet. You can then apply gloves, and you can use your alcohol wipe. And again, you're going to rub in circular motion starting at the center and going outward about 2 inches from the site. And you want to make sure that you let that air dry. And then once you're done with that, you're ready to reapply the tourniquet. So you would apply the tourniquet, and at this time you've already removed the butterfly needle from the packaging. When you insert the butterfly needle, you want to make sure that you're holding it by the wings. And when you insert it, you want to make sure that you're holding the needle at a 15-degree angle. And as soon as you insert the needle, once you have entered the vein, you will then lower to 5 degrees. But you want to make sure that it's one fluid continuous motion, that you're not jerking around, because that will hurt the patient. So you have your needle in. At this time, if you have evacuated tubes for different tests for the blood sample, you would be inserting those as well. And if you need to invert any tubes, you would be doing that all the while. Once you've established a good source of blood, you will then go ahead and remove the tourniquet, and usually about on your second to last or your last tube. And then you're ready to remove the needle. So what you'll want to do is you'll want to grab your gauze and you'll want to place it above the site of puncture. And when you remove the needle, you do not want to hold the wings. You want to hold underneath the wings for this part. And you want to pull the needle out the same direction and the same angle as the way you inserted it. So you'll pull it out quickly but gently. You'll apply gauze over top and pressure. You can also ask the patient to apply pressure to that site as well while you are disposing of your equipment, disposing of your needle into the biohazard sharps container as well. And once you see that the patient has clotted properly, you can apply the adhesive bandage, send the patient on their way, and you would then document the procedure into the patient's file, and you would send these specimens off to the lab. And that is it for the butterfly procedure.